For most nurses, nothing brings more joy than seeing their patients recover. Many develop strong emotional bonds with those under their care, making the loss of a patient one of the most painful experiences in their profession. However, many nurses and midwives work under challenging conditions. Some health facilities lack medical equipment and supplies, limiting their ability to provide quality care. And many face heavy workloads, with nurses often attending to far more patients than the World Health Organization recommends.
The ideal number of patients a nurse will take care of is about 6 patients per day. Now, the challenge about nurse-patient ratio, which I mentioned earlier, is standing in Uganda at 1 to 11,000 patients per nurse. It is something that is, by all standard, WHO standard, by all quality assurance standards, it is beyond the normal capacity of the nurse.
And most of the nurses that are out there are not employed, so there's really deployment does not meet the requirement of nurses maybe in the countries.
Those employed are overwhelmed, while a number of nurses and midwives remain unemployed. Experts say the excessive workload for the employed nurses is compromising patient safety and service quality as fatigue sets in and errors become more likely.
You find a nurse gets exhausted. And once you get exhausted, the brain gets tired. With the moment the brain gets tired, you're going to start making mistakes. And when you start making mistakes, that simply means you are likely going to give a wrong drug, you are likely going to give, a wrong care, you are likely not going to interpret what you are supposed to do, and you are likely going to harm the patient.
And we have also realized that maybe some of the private sectors, they do the underemployment, where I say that someone may be a degree nurse, but is being employed as a diploma nurse.
These concerns were raised during the International Nurses' Day celebrations at Nakasero Hospital. Stakeholders called for more investments in the profession and encouraged nurses to specialize in various medical fields to match the increasing specialization among doctors, something they say will improve both patient care and career development for nurses.
Now, in the current world, hospitals create units that are specialized, and they are run by specialists. And we can imagine a specialist is working with a nurse who is not a specialist. Do you think they can understand themselves? They don't understand themselves. That's why it becomes necessary. Where every facility is now transforming into specialization, there is also need for nurses to specialize.
If you look at probably our sister countries like Kenya, Tanzania, they do not have certificate nurses. So if there is a job market opened up in the East African region, it will only favor those that are at diploma level and bachelors and moving forward.
Nobat Atkunda, NTV News.